Welcome to Njobvu supplement. Don't forget to subscribe and like the video.
Health supplements. Njobvu health supplements. Our achievements are based on pure, clean, and natural ingredients, inspiring everything we do. Our rigorous testing and award-winning manufacturing allows us to achieve the highest level of purity. Njobvu health supplements are potent based on their proprietary formulas and groundbreaking research, which creates the most potent and reliable formulations on the market. Njobvu health supplements have been proven to be based on innovative.
Today we will learn about erectile dysfunction, low sperm count, infertility in men, what are the causes, what are the signs of infertility in men, and what we have to solve this problem.
Or impotence is a condition wherein a man experiences inability to achieve and maintain an erection for a satisfying sexual experience. Erectile dysfunction commonly occurs in elderly people because the erectile capacity decreases with age. Erectile dysfunction may occur when the blood vessels going to the penis become blocked or narrowed. There is an interference with the nervous system that triggers erection, or when there is a reduced libido. Certain diseases may cause blockage or narrowing of the blood vessels, such as diabetes, hypertension, multiple sclerosis, nerve damage, hormonal imbalances, atherosclerosis, and heart diseases. Unhealthy lifestyle choices also predispose an individual to have erectile dysfunction. A person is more likely to develop erectile dysfunction if he is obese, alcoholic, smoking, or abusing drugs. Medications may also cause erectile dysfunction as its side effects, like with antihypertensives, antipsychotics, antidepressants, and tranquilizers. Psychological causes can play a part in the occurrence of erectile dysfunction. People suffering from stress, fear, gloom, uncertainties, sadness, or problems in the relationship can suffer from erectile dysfunction. Often, erectile dysfunction is caused by a combination of physical and psychological causes. A person who suffers from erectile dysfunction may experience symptoms that include difficulty getting an erection, inability to maintain an erection, and decreased libido or sexual desire. Lifestyle modification is the least invasive type of treatment for erectile dysfunction. Healthy lifestyle choices that can help relieve erectile dysfunction are to stop smoking, drink alcohol moderately, lose weight when you're overweight, stay away from substance abuse, and to be physically active. Erectile dysfunction caused by medication can be treated by replacing or cutting back the medication under guidance of a physician. Psychotherapy is used to treat erectile dysfunction caused by stress and anxiety. It is also important to talk with your partner about your complaints. Medications like phosphodiesterase inhibitors and testosterone can also be utilized. These medications can only be taken orally, injected directly to the penis, or inserted into the tip of the penis. Your general practitioner can give you more information about the disorder and its possible treatments.
7 signs of infertility in men you should know about. But even if a baby is not on your mind, here are some of the alarming signs of infertility in men you should be aware of. 1. Pain and swelling in your testicles. Always check the health of your testicles, whether there is a certain tension, swelling, or even a lump, because this could be an indicator of varicocele. This condition relates to the enlargement of the testicle veins, quite like varicose vein, leading to a lowered sperm count and subsequently hampering the delivery of sperms. If your pain is too acute, consult your doctor. There are surgeries in order to fix the clumped veins. By ignoring this, you are cutting down on your chances of becoming a daddy. 2. Poor sense of smell. Now, this may not always be a foolproof indicator of infertility, but surely one of the signs of infertility in men. Usually this condition relates to a disorder that is passed down genetically called Kallman's syndrome, an extremely rare disorder in which your puberty never took off, or you are still in your puberty phase despite your years. As a result of this condition, you are totally immune to smells, and you cannot discern one smell from the other. This usually leads to the malfunction of the testicles and erectile dysfunction, and of course lowered sex drive. If you have had this condition for the longest time you can remember, and not because you recently caught a cold, visit your doctor. 3. Difficulty in ejaculation. This is a rather common sign of infertility in men, and it is referred to as ejaculation disorder. In this condition, either you ejaculate in fits and starts, or very low amount of sperms come out when you do, and is a grave cause of concern if being a parent is your priority. Sometimes retrograde ejaculation could be a cause for this great difficulty in ejaculation, because this condition draws the semen backwards to the bladder, rather than out of it. Some medicines are responsible for giving you this condition, while it can also be a neural problem. Either way, you shouldn't have difficulty ejaculating. 4. Low sperm count. Low sperm count is among the sure-shot signs of infertility in men, because if the sperms are not sufficient, it will not help the egg to fertilize into an embryo. You can't ascertain this at home, but if you have been having unprotected intercourse for about a year and still trying to have a baby, then you are suggested to take a test to ensure your sperm count isn't poor. Typically any lesser than 15 million sperm per milliliter of semen is a low sperm count. It ideally should hover between 20 and 150 million sperm per milliliter of semen. There are several factors that can be attributed to a lowered sperm count, such as chemical exposure, an imbalance of hormones, and infection in the testicles. Sooner you see your doctor, the better. 5. Your testicles are smaller than usual. This is again a very rare condition, also called the Klinefelter's syndrome, sometimes even genetic, when you are born with smaller testicles. Small testicles cause insufficient production of sperms needed for the fertilization of the egg. Predominantly, during puberty they are too tiny for the production of testosterone. This condition should be treated in your teen years, or you will have to seek the help of a genetic expert in infertility. 6. Low sex drive. Of course, you could be too tired on days to have sex, and we are not calling that low sex drive. But in general, if you do not have the urge to have sex, or you never initiate sex with your partner, you have a cause of concern here. This is among the definite signs of infertility in men. If your testicles are not producing enough testosterone to stimulate you enough to have an intercourse, you need to fix an appointment with your doctor. You cannot father a child if you are slowly going off sex. Get this checked before it is too late. 7. You are growing breasts. Gynecomastia results in a swelling in the breast tissues in men due to an imbalance in the sex hormones, androgen and testosterone. This leads to an enlargement in the breasts. If you have noticed your breasts growing, and that too disproportionately, you could be suffering from this condition, which will prevent you from having a baby. It is a major cause of male infertility, but it can be corrected provided you seek help at the right time. If you have noticed any of these signs of infertility in men, Visit your doctor. Baby or no baby, it's always better to get such symptoms corrected and stay healthy. Thank you for watching the video. Please subscribe my channel for more videos.
If a man has trouble getting a woman pregnant, he may have a condition known as infertility. His doctor may recommend a procedure to collect his sperm so it can be used to help him father a child. The male reproductive system includes the testicles, also known as testes, which are two glands in a pouch of skin called the scrotum. The testicles normally produce and store reproductive cells, called sperm. The scrotum is outside the body, which keeps the testicles cool enough to make sperm. Connected to each testicle is a mass of coiled tubes, called the epididymis. Each epididymis stores immature sperm while they continue to develop. During sex, sperm travel through a tube attached to the epididymis, called the vas deferens, to another tube, called the ejaculatory duct. There, sperm mix with fluid from two glands, called seminal vesicles, as well as the prostate gland. Now called semen, this fluid mixture exits the man's body through the urethra, the tube inside the penis that usually carries urine. If a man has sex with a woman, this process, called ejaculation, deposits semen in her vagina. Semen contain tens of millions of sperm. From the vagina, the sperm in the semen can travel to and fertilize an egg from the woman's body. Fertilization of the egg marks the beginning of human development during pregnancy. Sperm retrieval and collection are usually performed for a condition called azoospermia, where a man has no measurable amounts of sperm in his semen. There are two types of azoospermia. The first type, called obstructive azoospermia, occurs when the pathway of sperm out of the body is blocked. The second type of azoospermia, called non-obstructive azoospermia, occurs when the testicles produce little or no sperm. There are several procedures to remove fluid from a testicle or an epididymis to see if it contains healthy sperm. During percutaneous procedures, sperm are removed through the skin of the scrotum without making an incision. For example, during a percutaneous epididymal sperm aspiration, or PISA, the surgeon will insert a syringe into the epididymis through the skin. Fluid from inside the epididymis will be drawn into the syringe. Or, during a testicular sperm aspiration, or TISA, the doctor will insert a syringe into the testicle through the skin. Fluid from inside the testicle will be drawn into the syringe. If the fluid contains sperm, it can be saved for a later procedure to fertilize an egg. If the fluid retrieved through a percutaneous procedure doesn't contain any sperm, an open sperm retrieval procedure may be done to find other areas in the epididymis or testicle more likely to contain sperm. In any of the open procedures, the surgeon will begin by making an incision in the scrotum. The testicle and epididymis will be pulled through the skin incision, and another incision will be made in the outer tissue covering the epididymis and testicle. During an open fine needle aspiration, the surgeon will insert a needle into several areas of the epididymis. Each time the needle is inserted, fluid will be removed. During a microsurgical epididymal sperm aspiration, or MESA, the surgeon will use an operating microscope to get a magnified view of the epididymis. The surgeon will make a tiny incision in the thin tissue covering the epididymis to reveal the coiled tubes inside. Then, a tiny hollow tube, called a micropipette, will be used to puncture one or more of the coiled tubes and remove fluid from inside it. After removing the fluid, the tissue covering the epididymis will be closed with sutures. Another open procedure is called microsurgical testicular sperm extraction, or microtesy. In this procedure, the surgeon will make a small incision in the tissue covering the testicle instead of the epididymis. Next, the surgeon will use an operating microscope to look at the tiny tubes inside the testicle. A tissue sample of the tubes most likely to contain healthy sperm will be removed. The sample will be examined under a microscope to see if it contains healthy sperm. If no sperm are found, more samples will be removed and examined. Once sperm are found, the tissue sample will be stored for later use. Then the tissue covering the testicle will be closed with sutures. After all of these open procedures, the surgeon will close the tissue covering the epididymis and testicle with sutures. Finally, the skin incision in the scrotum will also be closed with sutures. The collected sperm will allow a man to father a child through intracytoplasmic sperm injection. During this procedure, a sperm cell will be injected directly into a woman's egg to fertilize it. If the collected sperm are not used right away, they can be frozen for use at a later date.
In vitro fertilization is a process where a woman's eggs are fertilized outside her body, then placed back inside her body to help her get pregnant. A woman's reproductive system includes the vagina, cervix, uterus, fallopian tubes, and ovaries. During the monthly menstrual cycle, one of the ovaries releases an egg in a process called ovulation. After ovulation, the egg enters the fallopian tube. A woman is most likely to become pregnant if she has sex in the days just before, during, or right after ovulation. During this time, a sperm cell from a man's reproductive fluid, called semen, is able to fertilize the egg just inside the fallopian tube. As it travels along the fallopian tube, the fertilized egg, now called an embryo, loses the outer cells that nourished it in the ovary. The embryo passes from the fallopian tube into the uterus. In the uterus, the embryo sheds its protective outer layer, called the zona pellucida, in a process called zona hatching. Zona hatching is necessary for the embryo to implant in the tissue lining the uterus. During implantation, a connection between the woman and the embryo begins to grow. This organ, called the placenta, allows oxygen and nutrients to pass from her to the embryo. In vitro fertilization may be performed if a woman has been having trouble getting pregnant, a condition known as infertility, or it may be done if a woman wants to have a child without a male partner.
Okay, stock is now ready. It has just arrived. So you can go on with the orders. I'll be packaging this in the morning together with the other things that are still remaining, so you can receive as soon as possible. This stock is very enough, but I can still say it's limited. Yes, still limited. It's enough but limited. That is the honey got to it. You can see everything is ready. Thank you.
Welcome. This is hand got with capsules that we have at Njobvu supplement. Don't forget that there are so many people, so many companies that produces hand got with, but our hand got with capsule, it look like this. This is the original. Don't buy the counterfeit from other companies. It has the label of our company. It has the logo of our company. It has the company number. So don't forget to check on this one, same like this one. So here is what the hand goatweed capsule does, and what it can help you people who have problems, who have challenges in the issue of bedroom, who have challenges to impregnate a woman, those who have problem like low sperm count, those who have problem like low libido, the desire has gone down. Here, this hand goatweed, it will help you a lot. It will help you to regain your performance as a man.
Horny
Goat
weed.
Like Kanye West, horny goat weed is loved by many but understood by few. Does it come from a goat?
Does it give you a boner?
Can you smoke it?
Let's strip the pants off this bad boy and get straight to it. What is horny goat weed? Legend has it that 100 years ago, a Chinese goat herder noticed that his goats were acting a little bit more lustful than usual. He looked a little closer and discovered that whenever his goats ate a certain weed, they started getting a little bit hot under the collar.
Myth or not, the story persists, and henceforth the magical herb was dubbed horny goat weed. Horny goat weed is an actual weed or herb that's traditionally used in Chinese medicine as an aphrodisiac to help support healthy libido.
AKA makes you want to do the sex. And it's a concoction of 17 herbs and minerals, 3 grams of Triplis terrestris, and 750 milligrams of Korean ginseng, all of which work in symphony to get you in the mood.
In layman's terms, the weed gets your motor running and the Korean ginseng keeps it going. And going, and going, and going, and going, and...
Phew.
Work some horny goat weed into your routine and soon enough you'll be feeling that big goat energy in your loins.
The name horny goatweed catches everybody's attention. But behind the clever name lies a serious herb. For horny goatweed is a genuine sex enhancer, a time-tested aphrodisiac that increases libido in men and women, and improves erectile function in men. Horny goatweed is a plant that contains high levels of erectin. This natural herb is a type of flavonoid that boosts energy, performance, and stamina while intensifying sensations.